Patient safety principles in surgical practice. Patient safety in surgical practice is critical to ensure optimal outcomes, minimize risks, and provide high quality care. The principles of patient safety encompass a multidisciplinary approach that involves healthcare providers, systems, processes, and patients. Below are the key principles and their applications in surgical practice. 1. Preoperative assessment and optimization. Thorough evaluation. A comprehensive medical history, physical examination, and diagnostic testing are essential to identify risk factors, e.g., comorbidities, allergies, and previous surgical history. Risk stratification. Tools like the ASA, American Society of Anesthesiologists, classification and risk calculators help predict perioperative risks. Patient optimization. Address modifiable risk factors, such as controlling diabetes, improving nutritional status, and ceasing smoking before surgery. 2. Informed consent. Clear communication. Patients should be informed about the nature of the procedure, alternatives, risks, benefits, and potential complications. Shared decision-making. Engage patients in the decision-making process to ensure they understand and agree with the surgical plan. Documentation. Properly document consent to ensure medico-legal compliance. 3. Teamwork and communication. Surgical safety checklists. Tools like the WHO Surgical Safety Checklist ensure critical steps are not missed. Effective handoffs. Standardized protocols such as SBAR, situation, background, assessment, recommendation, improve communication during patient transitions. Team briefings and debriefings. Preoperative briefings and postoperative debriefings enhance team alignment and review outcomes. Aseptic and sterile techniques. Infection prevention. Follow strict hand hygiene, proper sterilization of instruments, and use of antimicrobial prophylaxis. Surgical site preparation. Appropriate skin preparation and draping techniques reduce the risk of infection. Environmental controls. Ensure operating room OR cleanliness, proper ventilation, and temperature regulation. 5. Safe anesthesia practices. Pre-anesthesia assessment. Ensure a detailed review of the patient's medical condition, allergies, and prior anesthesia history. Monitoring standards. Use advanced monitoring equipment, e.g., ECG, pulse oximetry, capnography, to detect complications early. Emergency preparedness. Have resuscitation equipment and trained personnel readily available. 6. Error prevention. Timeout protocols. Conduct a timeout before incision to verify the correct patient, procedure, and site. Error reporting systems. Encourage a non-punitive culture for reporting and analyzing adverse events or near misses. Double-check mechanisms. Verification of instruments, medications, and equipment reduces errors. 7. Patient positioning. Prevent injury. Prevent injury. Ensure proper patient positioning to avoid pressure sores, nerve damage, or musculoskeletal injuries. Adequate padding. Use supports and padding to protect vulnerable areas. 8. Management of surgical complications. Preparedness. Anticipate potential complications and have protocols for immediate management, e.g., massive transfusion protocols, sepsis management. Monitoring and early detection. Vigilant intraoperative and postoperative monitoring for signs of complications such as bleeding or infection. 9. Postoperative care. Recovery protocols. Enhanced recovery after surgery, ERAS. Protocols promote early mobilization, optimal pain management, and reduced hospital stay. Patient education. Educate patients about signs of complications, e.g., fever, excessive pain, swelling, and when to seek medical help. Follow-up care. Ensure timely postoperative visits for wound checks and management of ongoing care. 10. Continuous education and quality improvement. Regular training. Continuous education for surgeons, anesthesiologists, and OR staff on new techniques and safety practices. Audits and feedback. Conduct regular audits of surgical outcomes and provide feedback for improvement. Adopt evidence-based practices. Stay updated with guidelines and research to ensure best practices. Amahri 11. Patient-centered care. Respect for patient preferences. Tailor care plans to align with patients' cultural, spiritual, and personal preferences. Emotional support. Address patients' psychological concerns and provide reassurance throughout their surgical journey. Conclusion. Patient safety in surgical practice requires an integrative approach that prioritizes proactive risk management, clear communication, adherence to evidence-based practices, and a culture of continuous improvement. By adhering to these principles, healthcare teams can enhance outcomes, reduce complications, and improve the overall surgical experience for patients.